Hello, everybody. This is Natasha Helfer, and this is Symmetry Live. We're excited to be back. Today is May 14th. Let's see, 10:30 Mountain Time in the United States. And today we are here to talk about Mental Health Awareness Day and actually Mental Health Awareness Month. Aha, better than just a day. And I've got several of my Symmetry team here with me today to talk about the topics. I'm going to quickly do a quick introduction. We've got Jenny Elledge coming at us from Florida. She's a marriage and family therapist and offers both therapy and coaching services through Symmetry. We've got Colette Dalton coming at us. This is her first time on Symmetry Live because she's a fairly new member of our team. She's located here in Salt Lake City, Utah. Does online and in person, correct? I believe, yes, both, again, therapy and coaching services. Super excited to have her on board. We've got Lindsay Hyde coming to us from Colorado, and she's one of our coaches. And we've got also a very new member, we're like barely getting you on as we speak, and it's Chandra Harris, who, now you're professional counselor, right? Is your background, is that correct?
Yes, I have my master's in clinical mental health counseling.
Mental health counseling, right? So, and she's coming at us from Texas, and she's going to be, I'm really excited because she's going to be one of our therapy providers for anybody who resides in Texas, both I think in person in San Antonio, is that correct? But also telehealth if you're in Dallas, Houston, Austin. There's a lot of big areas in Texas where she will be able to start offering services in that regard. So we are excited to just kind of talk a little bit about why something like Mental Health Awareness Month might be pretty important to quality of life. So anyway, Lindsay, you were talking really quickly about just stigmas and things that, I think we are getting a lot better, but I don't think that we've necessarily gotten over the hurdle yet as far as some of the stigmatization that a lot of people still feel when they think about maybe I need to get help for something like depression or anxiety or OCD or something to do with the brain. Yes?
Yeah, I mean, I've definitely seen huge leaps and bounds forward from, remembering thinking back to my own childhood and the way we all thought about mental illness. I mean, you kind of had ideas of some weird, crazy person hospital that people were wearing like straitjackets and stuff. That's kind of what I thought of mental illness when I was a child, and I've seen huge improvements. I think the stigma is helped when people are willing to be vulnerable and open. And so I love that. I remember as a young mother talking to another young mother, and we were both like stressed out. And I'm like, how do you handle it? And she's like, oh, honey, I'm highly medicated. And I actually just loved that. Like, I loved it. Like, it was, sometimes we need medication, and it's totally okay to be open about that. And I feel like the more open we are with our own struggles, the more other people feel like, oh, maybe it's really not that big of a deal. And I love Colette. Can you share what you were saying? That was so awesome.
Yeah, a friend posted a video yesterday that I ended up sharing on my professional Facebook page that I really liked. It was an illustration of a woman who, the idea was, if you wouldn't say it to someone with a physical disability or issue, don't say it to someone with a mental health issue. And so it started out with her going on a run with a friend, and the friend suddenly collapses because she broke her leg. And she was like, well, why are you down there? Like, get up, keep going, you're fine. Like, it's all in your head. She's like, no, literally my leg's broken. And you see this fake leg that's twisted all weird. And it gives some other examples. And I think that's so important. I talk a lot with clients about how mental health and physical health are tied, and you wouldn't tell someone who has diabetes to just pray and hope their insulin levels are fine. Like, there are medical things that you might need to do to make sure you stay okay, like you take your insulin. And so some people might need medication for mental health. The brain is just like any other organ, and things can go wrong. But I also don't want to knock mental health isn't just the absence of illness, right? There are other things to consider. And so I don't want to knock the importance of making sure you're getting enough sleep, and that you're taking care of stress levels, and that you there's lots of different ways to make sure that you're healthy. So I don't want to knock those things as well. Anyways, so I thought that was a really cool video and illustration and good examples about health is health, physical or mental.
I really appreciate you bringing that up because, when I first started studying a long time ago, 25, 30 years ago, there was still this kind of like idea of, well, what comes first, environment and or biology. And what I have really seen happen throughout the decades that I've been a mental health practitioner is really understanding that you can't really separate those very much. So what's happening to us biologically, what's happening to us environmentally, if you're having, a depressed brain, more than likely that's going to affect your gastrointestinal system, right? Or if you're having cancer or issues with something to do physically, that's going to affect some mental health conditions as well. So it isn't really the chicken and the egg. It's like a nice big omelet where it's all kind of mixed in. And why it's so important to take mental health seriously is that there really can be some physical ailments that are attributed also to untreated mental health conditions, as well as quality and lifespan, right? So you can actually lose years on your life in regards to untreated mental health conditions. And I think some of the stigmas go back to some, you mentioned praying, and I would say culturally, especially here in the United States, where, you think about our history of people coming over, the work ethic was very high. It was, kind of survival of the fittest. You kind of just got to get in there and work no matter what. And of course, also the big religious influences of, the Puritans and all of that coming into this country. You had a lot of like the answers to anything had to do with just, be better, do better, pray better, right? And so you get a lot of like the cowboy app type of, philosophies, called cowboy app, or it's all in your head. One of you mentioned that. And I think that unfortunately that really belittles what is happening for people. And if they do get help, it's almost like seen as a sign of weakness, or I've got to admit I'm broken somehow, or there's something wrong with me. I can't do it by myself is like this kind of shame space where a lot of people really still reside. And we also know that even though we are doing a lot better, in particular, certain cultures, I know that even like Black Americans, there's still a lot of stigmas around mental health, and also males. So in general, men have a harder time with a lot of the male toxicity topics that we've been talking about recently, of admitting, because again, men are supposed to be strong and, hard and be able to manage all of these pressures. So we see a lot of issues with substance abuse, domestic violence, all kinds of ways that when mental health goes untreated, it affects not only the individual, but the whole family system and community system that individual's a part of. Why don't we move really quickly, maybe Chandra and Jenny, you can talk a little bit about, well, how do you even know if you're having some mental health concerns, right? Like what's quote unquote normal versus struggling? What is a normal amount to struggle versus maybe there's something a little bit more than just what I should be experiencing, even if I'm going through something hard?
Sure, I have a lot of thoughts. Like this is really this is really interesting to me. I think what you were referring to, Natasha, when you're talking about genetics and your environment versus your personality and how that's all intertwined is called epigenetics, on how everything comes together. And so kind of like alcoholism, if you will, you're kind of predisposed, and so it's kind of lays dormant until you're faced with it. And now that comes to surface, right? And where we may not have known until we were faced with it. And that can go with anything. It can go with trauma or depression, or it just kind of lay dormant until we were faced now with an experience that kind of brought that up to surface. And so something I think that's important is to Brene Brown says that we're having an empathy crisis. And when she said it, she was referring to more us being empathetic to somebody else. And that was her context that she was using it. But it made me think that I wonder if we're having an empathy crisis to ourselves and not having the self-compassion, and to be able to not necessarily not pathologize real emotion. So if you're grieving or you're angry, that doesn't mean that there's something wrong with you. And so I think what Natasha's saying is, how do you know when you need professional help versus I just need more self-compassion and I just need to grieve. And my answer to that is that's up to you. And if you go in, don't think I'm going in because now there's something wrong with me. In fact, most people go in maybe not enough or too late. And so it's actually better to just, hey, you know what? I just need some support so that I can sit with my emotions in a compassionate curiosity kind of way, and not because I'm self-diagnosing, but I just need that extra support. And then you can go from there. You can even decide, you know what, it's not really for me, or I need to shop around, or maybe I want to go bi-weekly, but that kind of diagnosis really is empowering to be in your lap. But I highly, as I guess a therapist myself, am biased to get support sooner than later.
And I just want to add off that one analogy I use a lot. I think there is still that stigma of, oh, seeing a therapist, but in theory, people go see a doctor once a year for a wellness checkup, go to the dentist twice a year to check on your teeth. Like, why wouldn't you go see a professional to talk about your mental and emotional health? Nothing has to be wrong. Nothing's wrong with you, just to kind of check in. It doesn't have to be long-term. It can, even if nothing is diagnosably wrong. But it's really, I love what you're saying, Chandra, just about it's in you have the power about what works for you.
I'll add along to that. I think just making sure that everyone's aware that I think we might be working from an individual framework, but really, I mean, a lot of my clientele are couples. So if we can talk a little bit about relationship health, you know, that kind of goes along with the same idea of needing some extra support to help with, you know, your marriages, parent-child dynamics, to get some ideas, get another third person perspective, do some peeling back of the layers. And that's kind of another thing I wanted to talk about, you know, general expectations about what to happen in a therapy room or a coaching room with someone is, first of all, your professional is not going to be shocked by anything that you're going to share. And your professional is going to be very welcoming and open to lots of things that you're going to share with them. And there is a little bit of a peeling back of the layers process that happens. You know, in the beginning, there's a lots of like, well, give me a big picture context about your life. And then we can kind of zoom in and focus on some of the things that are pressing. But don't be surprised that, you know, it's going to take a few sessions if it's been, you know, something that's been going on for quite some time.
Yeah, I really appreciate you saying that, because I think sometimes it is scary if you don't know what to expect. And we'll talk about maybe some things to be looking for as you look for providers that can be helpful to you in a minute. But I wanted to just kind of go over just a few things of like kind of maybe warning signs, right? As far as maybe something is off. So a lot of times we think about feelings, and feelings are definitely one way that you can start thinking about, you know, is there something that I need to be paying attention to? And I think, as you know, depression and anxiety tend to be kind of like the two biggest, you know, things that are common actually in diagnosis and also talked about. Not that there aren't other things, obviously, that you can be diagnosed with, but so depression, a lot of people are like, well, I feel sad. So you're like, but I don't feel sad. Maybe I'm irritable. Right. So sadness is just one way that one of the many criteria that can be diagnosed in regards to depression. But again, children, adolescents, and even men don't often present with sadness necessarily. They're not necessarily taught to be sad as much. You know, women, I think sometimes in our culture are given more permission to express sadness. So it may be coming across as just having like a fog, not being able to make good decisions, feeling irritable, feeling tired. Maybe your sex drive is either increasing in ways that you hadn't expected or decreasing, as well as your appetite or your sleep habits. What about your social networks? Are you enjoying the things that you used to enjoy or not? Are you finding yourself not being able to sleep at all or kind of in bed most of the day, right? So these are kinds of things, and it doesn't have to be, again, like super dramatic of a symptom for there to be something that could be potentially either helped through talk therapy or psychopharmacology or lifestyle changes that a coach can help with. There's a lot of different ways that you can start approaching the healing and management of some of these symptoms, you know, as you get help. So I think that, you know, obviously some very severe thing or more severe things would be like suicidal ideation, feeling yourself like you'd rather. And suicidal ideation, again, is kind of complex because not everybody who has suicidal ideation necessarily plans on going forward with their plan or have a plan. But just the ideas that you'd like to escape. Wouldn't it be nice if I just didn't exist? Wouldn't it be nice if I got hit by a Mack truck? You know, those kinds of thoughts are actually very common. And if people don't understand that those are common ways that your system is kind of just seeking escape from pain or stress or, you know, the things that are bothering you, then you might think, what is wrong with me? You know, and make that stigma within yourself even higher than it needs to be. So anyway, those are some of the things, but I think even if something has happened, like, you know, I think about COVID, pretty normal to be stressed out during COVID, right? Pretty normal, especially if you lost your job or if you're, you know, dealing with something like an unexpected death, you know, that happened a lot with COVID and things like that. Like, so of course you're going to have feelings. So some of these diagnoses can be what's considered chronic. Like, you know, some people will tell me, hey, I've always kind of struggled with feeling low or badly about myself since ever I can remember. 10 years old, I can't really think of a reason why or, you know, a monumental event in my life that started this. So that's more of a chronic type of thing that then, of course, can be exacerbated by life events. But some people are like, no, I was fine. And then COVID hit, right? Or this thing happened in my life. And I haven't really been able to quite get back to my normal self or what I consider my best self since then. And it only takes about 6 months for your brain chemistry to start changing in some very significant ways. So if you think about like the loss of a loved one, well, it's pretty normal to be sad for 6 months. Pretty normal to be sad about that maybe for years, you know, especially if it's a death of a child or something very traumatic that has happened. So even though it's normal, it can still have an effect on the patterns and chemistry in your brain and why it's really important to get the help that you could possibly benefit from if you're doing some of those things. Can we talk just briefly about what you all think are maybe the types of help that are out there and also when people can know that it's a good fit?
Yeah, it might be helpful to know that, you know, if you feel like your daily day-to-day functioning is kind of being impacted, like you're having a hard time doing work, you're having a hard time relating to people, you're noticing more, you know, significant changes in how you're interacting with the world, then definitely reach out to talk to a mental health professional. And that professional is going to kind of help guide you to see if there's any type of mental health illness diagnosis that could possibly warrant any type of medication. And that will get referred out to either your primary care doctor or a psychiatrist, kind of depending on what's going on. Some primary care doctors are comfortable with that, and some are kind of like, I'd rather you go talk to a psychiatrist. Your psychiatrist is not going to likely, some do, is not likely going to provide you with any type of counseling. They're really just there to kind of hear your symptoms and write you a prescription for the most part. That's what they're well trained for. They're a medical doctor. Your mental health provider is going to help you with coping skills and strategies and ways of relating. Sometimes you might need both medication and some counseling. That the research tends to show that's pretty effective.
Awesome. Any other thoughts about finding a good fit?
I think it's important to highlight that not every provider is going to be a fit for every client. Personality, the research shows that the therapeutic relationship is the most important determination of change, more than just about anything else, more than the type of treatment or anything like that. And so I think sometimes people get discouraged and say, oh, therapy is not for me. I tried it, didn't work. And I would encourage you, maybe it was the provider that wasn't the right fit for you. We all have different personalities. We are people too. And we have different areas of expertise as well. If you were seeing someone who's a big generalist who just kind of sees everybody for anything, And maybe you need to go to someone who specializes in OCD if that's what you're dealing with, or maybe you need to see someone who specializes in dealing with people with an addiction. So those are definitely some things to consider.
I wanted to just encourage people. There is a shortage of therapists right now. I'm just going to say this, like, it's really hard. I'm dealing with this in my own immediate family. It's been really hard for us to find people that are qualified and that are a good fit. So, which is kind of hard when you're like depressed to feel like you just can't find the help you need. So I just wanted to kind of put that out there to expect that this could take time to find what you're looking for and find someone that'll take your insurance or whatever, but just keep persevering, because, you know, obviously your mental health and wellness is extremely important. So don't give up, keep trying. And we're here.
Yeah, no, thank you. I think that, I mean, there's so many things out there. I'm sure we won't have a comprehensive list, but things that you might find helpful to know about. Like, for example, if you've got kids 12 and under, there are play therapists, you know, taking a 7-year-old to a talk therapy, you know, where they're going to talk to an adult. It's probably not going to be the best fit, right? So there are people who specialize in working with children and play therapy. There are, of course, specialties in trauma. There's different kinds of therapies like EMDR. There's medical interventions that are not even pharmacological, like electric shock therapy, which I know a lot of people are probably like, that sounds really scary. And yet it is the most effective form of treating depression, you know, that we currently have. There's, of course, different types of lifestyle issues. You know, when I think about like the trifecta of mental health, I think about talk therapy approaches, which in of itself has a lot of different types, right? There's cognitive behavioral therapy, there's acceptance commitment therapy, there's you know, dialectical behavioral therapy, there's, you know, lots of different schools of thought in the talk therapy world. There's pharmacological and medical interventions. And then of course there's lifestyle and strategy changes, you know, how you eat, how you sleep, your daily habits, whether or not you're exercising. So when you think about, you know, this kind of like more holistic approach to thinking about the quality of your life, there's lots of different ways to consider it. Sometimes that can feel overwhelming. If I'm depressed and I have to worry about finding a therapist, whether or not I'm going to exercise and tracking my sleep, I'm already like more depressed, right? So sometimes that can feel really overwhelming. So sometimes that's why it's good to start even just with one step, or, you know, or try to find that one professional. Like even our coaches who don't necessarily treat depression will help you like kind of just come up with a basic plan, you know, and maybe how do you make that first step to contact a mental health professional, and what if it doesn't go well and it takes 2 or 3 times, right? That's the stuff that can get really tiring and overwhelming, or to help you find the resources, because not everybody has insurance or not everybody has the money to pay the specialist or to find the specialist. So those are all things that, you know, we here at Symmetry, as well as many other community centers and mental health practitioners, are dedicated to trying to help you find the easiest access to the issues that you are currently facing, and why assessment is so important, right? Because most of us don't just come in with one nice little tidy issue. It's like, you know, if I've got anxiety, that's probably affecting how I parent. Maybe that's affecting my marriage. Maybe it's affecting my work. Maybe several stressors have come in that I wasn't expecting this last year. So on the one hand, we want to say like, we get it. It's a big chunk to try to figure out. On the other hand, there are people in place, and we hope to be one of those resources that we can help you bite off chunks at a time. Any final thoughts from anybody before I close up? All right, well, mental health, that's where it's at. We're trying to tell you it's very important. There's no shame in the game. Like we all struggle. We're all human. We all show up in different ways. Some of us more intense than others as far as the frequency and or severity of things. And usually there's reasons for that make sense. doesn't mean that you're broken or that there's something wrong with you. Let us help you find solutions or find other resources in your community that can help you, because yeah, we want you to live a long and healthy and somewhat content life. I think that's, I never say happy life. Say if we can do somewhat content, we're doing good. Content and sustainable. So, all right, everybody, have a great weekend and we'll see you next time. Bye-bye.